Hello, my name is Robert Harrison. I'll be presenting our study which looked to determine if women undergoing urodynamic testing were able to accurately predict their voided volumes and post-void residual. I have no disclosures to report. As a bit of background, voiding diaries are a helpful tool in assessing patients with voiding complaints. Despite their use in diagnosing and monitoring many urologic conditions, patients often find voiding diaries to be inconvenient and cumbersome to complete. As a result, physicians often end up asking patients to assess their voided volume subjectively. A recent study found nearly 50% of men with lower urinary tract symptoms could estimate volumes within 20% of their actual voided volume. However, there are no published studies to date supporting the accuracy of these subjective self-assessments in women. In our study, we aimed to determine if women undergoing urodynamics testing could accurately predict their voided volume and post-void residual volume. In this prospective study, an institutional review board approved questionnaire was administered to female patients undergoing UDS at our institution from December 2020 to April 2021. Women were excluded if they were under 18 years of age, pregnant, or had underlying neurological or visual disorders making volume estimation difficult. After obtaining informed consent, patients were asked to predict their pre-void, post-void, and post-void residual volumes quantitatively. On the left, you can see some of the demographic characteristics of the 82 women who underwent urodynamic testing. They had a mean age of 53.8 years and a median BMI of 28.1. More than half were postmenopausal, and common comorbidities included hypertension, thyroid disease, and hyperlipidemia. And although it's not shown on the table, 10 patients received prior surgical treatment for their voiding dysfunction. 4 had previously been treated with a mid-urethral mesh sling, making it the most common surgical treatment. The most common primary indications for UDS were stress incontinence, which about 1 in 4 women had, followed by mixed incontinence and frequency, urgency, and overactive bladder, which were grouped together. Stress incontinence was the most common primary diagnosis, followed by sensory overactive bladder, low bladder capacity, and bladder oversensitivity, which were grouped together, and almost 20% of these patients had a normal UDS study. Here you can see the voided volumes and post-void residual outcomes. On the left, you can see the median estimated pre-void and post-void volumes were 150 cc's and 137.5 cc's respectively, compared to the median actual volume of 103 cc's. Pre-void estimation percent error was 43.2%, and post-void estimation percent error was 23.2%. In the right column, you can see the median estimated post-void residual was 0 cc's, which was lower than the median actual PVR of 5.0 cc's. So our results found that women tended to overestimate their voided volume both before and after voiding, median percent error 43.2% and 23.2% respectively. Only 17.1% of women were able to estimate their voided volume within 20% accuracy before their void, while 28.9% of women were able to do so after voiding. Post-void residual was typically underestimated, with a median percent error of -20%, and 24.7% of women were able to estimate PVR within a 20% margin of error. In closing, our preliminary findings suggest that most women undergoing UDS are unable to accurately estimate their voided volumes and PVR, underscoring the importance of voiding diaries, UDS, and PVR assessments in this population. That concludes my presentation, and I would like to thank you all for taking the time to listen.